Okay, this is a picture of the brainstem. Um, the autonomic nervous system is housed in the brain system. The ANS works to maintain homeostasis in the body. It is composed of three parts: the sympathetic, which is your fight, flight, or flee response; the parasympathetic nervous system, which is the calm after the storm, like the rest and digest; and the enteric response. The enteric nervous system. Now, the parasympathetic and the sympathetic usually work synergistically with one another, like they contrast one another. But in states of constant fight, flight, or flee response, you kind of get stuck in that sympathetic, uprelegated state, and you can't quite calm down and experience the parasympathetic calm of the rest and digest. And because of the different components that the autonomic nervous system regulates, it can cause a lot of problems, which we'll see in the upcoming slides. For some reason, the human brain can think our way into an anxious state, but not out of an anxious state. That's a problem. When this happens, we are then stuck in a sympathetic state where the effects of trauma become long-lasting. Chemical messengers, dopamine, norepinephrine, and epinephrine, commonly known as adrenaline, remain in the system, and that's where we get our adrenal fatigue. We have dilated pupils, dry mouth, decreased mucus production, that decreases our immunity, increased heart rate, relaxed bronchial muscle, decreased peristalsis, that's constipation, decreased motility of the large intestine and the small intestine, that's also constipation, increased conversion of glycogen to glucose, which I found to be kind of interesting because that contributes to type 2 diabetes. So here we see the autonomic nervous system and everything that it controls. That's what I was just talking about on the previous slide. So you have your cardiac system, the circulatory system, the nervous system, respiratory system, muscular system, reproductive system, skeletal system, digestive system, excretory system, endocrine, immune, and integumentary. So that's pretty much every body system there that will be affected if you get stuck in this uprelegated state. But the most important ones are of course, the digestive, but muscular system for speaking about chronic pain. And our skeletal muscles are controlled by our brainstem. That's one of our sensory components. So that's where the chronic pain comes in as far as suffering from injury and what could possibly be a cause. Could possibly be a cause of chronic pain in tightened and shortened muscles, definitely. And then we look at the psoas as it relates to trauma. So part of the stress response is to protect the internal structures, which is carried out by flexing the trunk. Part of it is carried out by flexing the trunk. The psoas in a chronically shortened, tightened state will more than likely restrict blood flow to the lower limbs, can cause dysmenorrhea, constipation, hip pain, and lower back pain. In Eastern cultures, the pelvis is kind of considered like the life force of the body. In the Western cultures, we kind of think the brain is the life force of the body. And it's interesting to see how much the psoas has to do with chronic pain and trauma. When we think about, especially as Westerners, we always think that we should be able to think our way out of a traumatic event or these feelings of anxiety. But when you think of it as the pelvis being the kind of like the heart and soul of the body, it kind of, puts a different spin on things. So reflexercise is one of the associative awareness techniques presented by Scott Musgrave. And the goal is to retrain the brain using the concept of neuroplasticity. And the associative awareness techniques are interesting. The reflexercise is the only one I've looked at so far, and I've actually used reflexercise on the field with a patient. He wasn't one of my patients, he had an emotional response to a touchdown, and he just couldn't handle it, and just had a build up, and just kind of threw a temper tantrum on the field. So he was out there for a good 5 minutes, and we did a little bit of reflexercise to get him off the field, because he really wasn't moving anywhere. He wasn't going to go anywhere until he could get himself together, and reflexercise helped him so that we could continue with the game. So here's a chart that kind of shows the body reactions during the startle reflex, and how it associates a threat, and it explains these reactions and the messages communicated to the brain when performing reflexercise. So it's interesting. It shows like the startle reflex, how your hands are clenched and your arms cross the body to protect your internal organs, your shoulders shrug upward, your head juts forward a little bit, and your eyebrows are down so you can see, and your eyes are open as wide as possible so you can see, and your toes extend upward so you can get ready to run. This slide this chart shows the systemic changes that occur during a flight, fight, and freeze reaction. It shows how it affects the nervous system, the muscular system, the cardiac system, and the circulatory system, respiratory, endocrine, and all the other ones we talked about for autonomic nervous system. It tells the body's reaction to those and the explanation. I think the last one for the immune, digestive, and excretory is kind of interesting. It says your brainstem initiates the same neurological call to action during times of actual danger as it does for unresolved pain, persistent stress, trauma, and anxiety. This can often result in long-term digestive and immune system deficiencies, many of which are treated with pills by the medical community at large. And the next concept I'm very interested in working with is the trauma release process by David Berceli, I think it is. One of my colleagues said she had a patient who kept vomiting like before each game and during each game, and she was like, he just gets so worked up. And I said, oh, well, why don't you try these? And I emailed all of you the TRE exercises, the ones that Dr. Nasipini took us through back in the summer when we were in Idaho, in case you wanted to try them. But the goal, the TREs are designed to initiate the body's shake response. This is the human body's natural process to release deep chronic muscle contractions brought on by trauma. The exercises can be done alone because a lot of people, it's hard to try to get some patients to do the reflexercise, let alone, have them just shaking all over the place. But this is something you can do alone. Like, you can show them how to do it, and they can take it home and try it and report their results to you. It has a cumulative effect of relaxing the body at a deeper level, and it's designed to stress the 7 hip flexor muscles to kind of promote that deeper healing. And there was studies have been done to show that shaking is has benefits to releasing chronically stressed muscles, and helping to dissipate that unspent energy from the norepinephrine, the adrenaline being distributed to the body and not being used, because it's that chemical response, it kind of stays in the bloodstream and doesn't go anywhere. So I know one of the barriers to doing this is like, especially like, there's no privacy in my clinical setting unless I could get the patient down before school is over, which I have been able to do. But there are several patients who I cannot do that with. So I print the exercises out with them. I take them someplace quiet, somewhere where none of their peers are around, because life as an adolescent is tough. You know, they don't want a whole lot of people laughing at them like, you know, what are you doing? But for most of my patients, I've only tried it with two. But the adults, actually, it works well for the adults as well. So I really like the way this is going so far. I've only tried it, you know, for the past season, and I'm interested in trying it for basketball season. I think I'll see some good results with the basketball team as well as the indoor track team. So there are a few other readings that I would like to read. I would also like to really get a better understanding of how the psoas affects this whole chronic pain and relieving chronic stress. And I also have ordered a couple of books by Peter Levine, Walking the Tiger and Freedom from Pain. So I'm really excited about my new action research topic, and I hope this provided you with a little bit of insight. And if you have any questions, please upload them to TaskStream and try the TREs that I sent you. Try using them in your clinic and let me know what you find. Talk to you later. Bye.